Hi to everyone at the Boys and Girls Club of Lowell who's watching this video. My name is Priyal Patel, and I'm here today to talk to you about the field of public health and sort of career aspirations and exploration in that field as well. So just for a bit of context, I grew up in Lowell. I went to Lowell High School from 2011 to 2015, and while I was there, I was part of different sort of extracurricular activities, National Honor Society, the Outdoor Adventure Club, Science Club. I also was in the bioscience pathway, so it was a sort of subset of courses that I took that were related to the field of healthcare, and that's something that I was always interested in, so I decided to go down that pathway so I could have a more subset of courses that I would have in my tool belt to help me understand the field. Also, for a bit of background, when I was in high school, when I took the microbiology course that was offered through the MCC dual enrollment program, that really got me interested in the field of public health because I was able to learn about different microbiomes and how it affects like our globe on a global stance, just like we're going through right now in the pandemic. So learning about infectious disease and just sort of different aspects of how to control and prevent diseases was something that I really became interested in. And because of really that course, I decided to enroll at UMass Lowell as a public health major. And while I was at UMass Lowell, they had different concentrations in the major of public health. So I decided to do a public health degree with a concentration in health science. So it was kind of like preparing myself both for a clinical role, but also getting the core disciplines of what public health is. So I thought that was really great to have that sort of wide aspect within my schooling career. Um, just for a bit of background, public health, what I've learned through my experience is really about providing a resource and sort of development standpoint to allow everyone to live healthy lives. So from that aspect, I really got to dive into different aspects of public health, which is so vast. So learning about things like epidemiology or public health education, um, administration roles within the public health and healthcare system. So by being exposed to all of these different aspects, I really got to understand what is the field really like. And I really just learned that it's so vast. There's so much interlay in between preventing things like health diseases and different consequences, but also learning to how to maintain and uphold that sort of structure of a healthcare system. So for me, when I was doing all my coursework, I really found the healthcare system, like how our hospitals are structured and how we um, give out treatment and how it's sort of delivered to be very interesting. So I really wanted to learn more about that. So I decided to sort of research and look into what the healthcare administration field was like. And I really thought that that field was more aligned to what I wanted to do and sort of creating an impact and creating positive changes in the healthcare system to allow better outcomes and delivery for all of us when we go out into the hospitals or just sort of healthcare system to get treatment and preventative care. So that was sort of something that I, through my college experience, wanted to just sort of move on forward with. So I had decided to really get a lot of work experience while I was a college student. And so I worked at a lot of different places. I worked at Lowell General Hospital in the emergency department as a registrar, which gave me great understanding of how an ED in a hospital works. I also studied abroad for a semester in London, England. And while I was there, I did an internship with a mental health charity called MAC UK, and they do a lot of work with young people and just working to provide mental health services and developmental services to those young people who lived in the community. And it was a really great experience just to work alongside their CEO and their executive leadership team. Um, and then I also got an internship during my junior year after I came back from London at the Massachusetts General Hospital. And through that experience, I was able to learn a lot about hospital administration. I interned in the Department of Orthopedics under the executive director, who was my preceptor, and really got to get a deep dive into everything that it took to run a specific department of a hospital. It was great. I got to rotate with all of the different managers and directors of the department, learn about clinical operations, finance, research, and I also even got the chance to shadow in multiple times in the OR to watch different surgeries, which was really cool. And I think overall, just learning about the healthcare administration field gave me the understanding and personal fulfillment of all of the work that happens behind the scenes, and how that can really create an impact to the field of public health and making sure that people have the opportunities and resources to live healthy lives. So I really like that behind the scenes work rather than working as like a doctor, doing surgeries or seeing patients in the clinic. I really found my niche in that background work and just really working to make sure that the current processes and things that are in place are proper for everyone to receive the care that they get in the hospital. So that was something that I really was really interested in and decided to move forward with it. And so while I was intern at MGH, I did a lot of work um, to just sort of understand the scope and just meet lots of different new people. So, like I mentioned, I interned in operations and orthopedics, but then I also got to do a lot of work in the international strategy sector of the hospital, which was really cool. And then also just process improvement work to really just make sure that the care that we're providing to the patients in the hospital is at the utmost quality and service that we can provide. So it was a really vast sort of experience that I'd gotten from my internship. And towards the end of my senior year, I was looking at different positions at the hospital because I really liked working there. And one position that I applied for and eventually got was a project manager position in the practice improvement division of the hospital. So doing a lot of project process improvement work across the entire hospital. And here I am now over a year into my role as a project manager at the hospital, directly out of college. A lot of people that I work with have recently graduated with their master's degree, but because of my internship experience, I was able to really facilitate that and be in the role that I am today, which is really great. And I really value my internship experiences in the field of public health to really land me in the role that I am today. So if anyone ever has any questions, please feel free to reach out. I'm going to provide Kara with my contact information, and if you ever wanted to touch base with me, you're more than welcome to. And just to go through the questions now. So, what's your favorite and least favorite part of your job? So, my favorite part is really just working to facilitate change. Like I mentioned, we're doing a lot of like process improvement work behind the scenes, and a lot of that work directly impacts patient care, just sort of how operations flow in the hospital. So for me to understand, like, my work sort of has a lasting impact is really profound for me, and I really value that. So I think just sort of knowing that I have an impact is really important to me. Another really great thing is just like working in collaboration with my team. I really like being a part of a team and just sort of working with others to sort of problem solve and just sort of collaborate and have people who are also very passionate as well and the things that I am as well. So that's great. The least favorite part of my job, I can't really think of one specific thing, but there are times where it's stressful, like you're in situations where you have to really troubleshoot and think of how to solve these things, and it can be hard. So that can sometimes be sort of scary or just sort of anxiety inducing, but you always have people to reach out for, which is great, and provide you with support and just sort of think through how to solve a situation or problem that you're in. Next question. What advice would you give a student interested in this pathway? So my number one piece of advice would be to get experience. I think my sort of background and experience that I've gotten is so invaluable to where I am today. So that's something that I highly would recommend is just getting opportunities. Reach out to those who are working in areas you're interested in and just sort of sit down and have a conversation about what their job is like and see if an internship is possible. And those aspects can really open doors for you. Next question. What do you have to depend on others in order to accomplish your job? So I have to depend on a lot of people in order to make sure my job gets done. So both my internal team, but also all of those who work in the hospital that we work with in terms of clients. So specifically making sure that things get done on time, um, questions are being asked that need to be asked, so that sort of thing. So we're sort of always depending upon each other to make sure that different aspects get taken care of in order to ensure that projects and timelines move on the timeline that they need to. And last question, what types of education training is recommended for this kind of work? So a lot of people that I work with have their master's degree, so they get their master's in public health or their master's in business administration. So that's sort of a lot of where that training comes from is through schooling. Um, like I said, in my case, I only have my undergraduate degree and I'm working in the same position as they are. But I also have colleagues who have worked at Mass General for like over 30 years and have gone up the sort of career pipeline and are in higher positions than they are today when they started. So there is a lot of internal growth that you can be provided with. And so it's not necessary that a degree is needed, but there's definitely opportunities and chances to just work your way up the career ladder. I know one of my directors you started at MGH as a sort of assistant, and now today, 30 years later, she's a director of one of the departments that I work with. So there's definitely career growth possible, and that's sort of the aspect that I work with is behind the scenes process improvement work, working to make sure that operations and healthcare delivery is done in a safe and effective manner. And I hope that this is really helpful for you. And if you ever have any questions, please feel free to reach out to me. All right. Thanks, everyone. Bye.